Hello. This is the third part for chapter 17, which is on blood. And this one is going to focus on erythrocyte disorders. So and again, erythrocytes are red blood cells, and red blood cells are the cells that are primarily responsible for carrying oxygen to the various tissues in the body, right? So most erythrocyte disorders are classified as either anemia or polycythemia. And anemia is blood that has abnormally low oxygen carrying capacity that's too low to support normal metabolism. So we go back to the situation where the tissues are going to be hypoxic. This is a sign of a problem rather than a disease itself. So this means that something is going to be causing the anemia. Symptoms of anemia are fatigue, pallor, dyspnea, and chills. And there are three groups based on the cause, and one is blood loss, another one is not enough red blood cells produced, and finally we have too many red blood cells being destroyed. So with blood loss, this is hemorrhagic anemia, and rapid blood loss would cause hemorrhagic anemia. And an example of this would be a severe wound, and this would just be treated by blood replacement. And then there's also chronic hemorrhagic anemia, and this is caused by a slight but persistent blood loss. And an example of this would be like a bleeding ulcer, a hemorrhoid. And then in order to treat this, you need to solve the primary problem to stop the blood loss. The second cause of anemia is not enough red blood cells being produced. And we have iron deficiency anemia. And this can be caused by hemorrhagic anemia, but also by low iron intake or impaired absorption. So basically, somebody's they don't have enough iron in their diet, or for whatever reason, they are not absorbing the iron properly. It could be something like, for example, gastric bypass surgery, something like that. Red blood cells that are produced are called microcytes. They're small and pale in color, cannot synthesize hemoglobin because of the lack of iron. And the treatment is going to be iron supplements. There's pernicious anemia. This is an autoimmune disease that destroys the stomach mucosa that produces something called intrinsic factor. An intrinsic factor is necessary for the absorption of vitamin B12. And then if you remember from the last talk, vitamin B12 is necessary to help the red blood cells divide. Without B12, the red blood cells actually just get bigger, but they cannot divide, and it results in something called macrocytes. Treatment is going to be vitamin B12 injections or nasal gel. Can also be caused by low dietary intake of B12, and this can be a problem for vegetarians. Then we have renal anemia. This is caused by a lack of EPO. This often accompanies renal disease. The kidneys just simply cannot produce enough EPO, and then the treatment would be synthetic EPO. And then we have aplastic anemia. This is destruction or inhibition of red bone marrow. And Remember, red bone marrow is what produces our blood cells. This can be caused by drugs, chemicals, radiation, viruses. Usually the cause is unknown. All formed element cell lines are affected, which means red blood cells, white blood cells, platelets, all affected. So this is going to result in anemia as well as clotting and immunity defects. Treatment short term would be transfusions, long term would be transplanted stem cells. And then finally, we have too many red blood cells being destroyed. And so this could be caused by the premature lysis of red blood cells, referred to as hemolytic anemias. And this can be caused by incompatible transfusions or infections or hemoglobin abnormalities, which is usually a genetic disorder resulting in abnormal globin. And the examples we have here are thalassemias and sickle cell anemia. And then thalassemias are typically found in people of Mediterranean ancestry. One globin chain is absent or faulty. The resulting red blood cells are thin, delicate, deficient in hemoglobin. And then there's a number of subtypes that range in severity from mild to extreme. And the severe cases actually require monthly blood transfusions. And then there's sickle cell anemia. And so people with sickle cell anemia have hemoglobin S, which is a mutated hemoglobin. And it's actually only one amino acid is in the wrong place in the globin beta chain of 146 amino acids. So what happens is when oxygen levels are low, the red blood cells become crescent shaped. So just for example, if the person were to exercise, their oxygen levels would drop, and then their red blood cells would become crescent shaped. Those misshapen red blood cells rupture easily, block small blood vessels, and result in poor oxygen delivery and, unfortunately, pain. Sickle cell anemia is prevalent in Black people of the African malarial belt and their descendants. There is a possible benefit to having sickle cell anemia, and that is that people with sickle cell do not contract malaria. And malaria kills 1 million people each year. People that have 2 copies of hemoglobin S can develop sickle cell anemia. However, individuals with just 1 copy of hemoglobin S have a milder disease and a better chance of surviving malaria. Treatment, so we have acute crisis treated with transfusion, inhaled nitric oxide, and then you would want to prevent sickling. So hydroxyurea, which would induce the formation of fetal hemoglobin, which does not sickle, stem cell transplants, gene therapy, and then nitric oxide for vasodilation. So up here we have a normal red blood cell, and then down here we have a sickled red blood cell. Then we have polycythemia. This is an abnormal excess of red blood cells. This is going to increase blood viscosity, causing sluggish blood flow. And then polycythemia vera is a bone marrow cancer that leads to excess red blood cells. The hematocrit can go as high as 80%. Remember, hematocrit is supposed to be like 45%. Treatment is therapeutic phlebotomy, so literally removing the blood. And then secondary polycythemia is caused by low levels of oxygen levels, for example, high altitude or increased EPO production. And then finally, we have blood doping, and this is something athletes do. Some athletes, they will remove and store their blood and then reinfuse it before an event to increase their oxygen levels for stamina. And this is your question. And this is all I have for you for this talk.